Hi, my name is Sarah, and today I'm going to present my poster to you all. First, I'm going to start with some facts behind gestational diabetes. Obesity has brought on many health complications that are increasing medical costs throughout the United States. One of the complications that we are all very aware of is diabetes, and today we are taking a closer look at the type of diabetes that can not only impact a mother but her unborn child. According to Healthy People 2030, a major issue they want to address is obesity and overweight factors for the population. As we know, this was also included in Healthy People 2020. We all know that diabetes is a complication of obesity, but to take a deeper look at it and how obesity can affect childbirth and being a mom, I kind of have developed a question that kind of takes a broad subject of obesity and diabetes and really narrows it down to a certain population and culture. Gestational diabetes occurs when your body cannot make enough insulin during pregnancy. Major factors for this are maternal age and obesity. About 50% of women with gestational diabetes go on to develop type 2 diabetes, according to the CDC. And according to the American Diabetes Association, the estimated cost of diabetes in the United States in 2017 was $327 billion. That's about $1,000 per person in the United States. To kind of dive into the topic of gestational diabetes, I'm going to kind of go over a couple things and how it can not only affect the mother and how she can develop type 2 diabetes later on in life, but how it can also affect the child, just so you have a little clearer understanding on gestational diabetes before we dive into the topic. So complications that can affect the baby are excessive birth weight. Very large babies over 9 pounds can actually get wedged in the birth canal, and birth injury can occur. Earlier preterm birth can also occur, and because of the high blood sugar by the mother, it can increase the risk of early labor and delivery. This can also end up, because of the early birth, with the baby having serious breathing difficulties. And the baby can also have low blood sugar, hypoglycemia, shortly after birth, which can actually cause seizures in the newborn child. And then the babies that have been born to mothers with gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. The probably most severe is untreated gestational diabetes can actually end up in stillbirth. So my topic, I decided to go into specifically the Hispanic Latina culture and the women of this culture, because just kind of at like when we first started the search, I first started with all minorities because I know that minority women are more at risk for obesity and therefore more at risk for gestational diabetes during pregnancy. So my first portion that I developed was my question. So my research question is, what is the Latina Hispanic women's experience with having gestational diabetes, or GDM, in the United States? My population specifically is Hispanic and Latina women. My interest is their experience in having GDM, and the context is living in the United States. This topic obviously can be applied to other countries, but since I live here in the United States and will be potentially practicing in the United States as a nurse practitioner, I wanted to make it a little more meaningful and a little more relatable. So we start with our data extraction. The culturally appropriate approach to health. This is kind of a main topic and subject that I pulled from my 3 articles. A common finding within all 3 studies was the incorporation of the primary language and culture of these women. So 2 of the studies were qualitative and 1 was a systematic review. Both qualitative studies actually use the Spanish language when either interviewing or consenting both with the groups of women that they were using in their study. And that had a big impact on the women, and they truly appreciated it, and they voiced how much they appreciated and how much it actually meant to them within the study. Culture is very important to Hispanic and Latino women, and some cultural beliefs may create a perceived health barrier. There is a term called Marinismo, where the woman of the family is seen as being second to not only her children, but the rest of the family's needs. This is very important in their culture, and therefore I do not think that traditional Western medicine always approaches prevention with incorporation of culture. And this is just an example. If the mother sees herself as second to her children and the rest of her family, we have to make sure that as providers, our approach recognizes that. And I do believe the prevention and treatment of GDM or gestational diabetes may not always, one-way approach is not always the best for these women. The studies also picked up on educational deficits on diabetes and GDM in general. In relation to culture, some women equated being stressed or eating a lot of sugar being the direct cause of diabetes, with little knowledge on how it could affect their unborn child or themselves down the road. Again, this is just an opportunity for education, and not only just general education, but formulating education to fit the specific woman and her needs and her cultural beliefs in a way that she will not only understand, but the way she can apply it down the road. Another common topic that was extracted from my search was the feelings of guilt, anger, and sadness of those who were diagnosed with gestational diabetes. The women in these studies across the board, in all 3 studies, explained feelings related to their GDM diagnosis and what it could mean for their child. The emphasis on the child and less on themselves showed how important their children are to them and the impact of that Marinismo, as I stated before. Another topic that was common again was the socioeconomic status of the women. The areas that these women were interviewed were from largely poorer areas and even considered food deserts because of the lack of fresh groceries. One of the studies was conducted in El Paso, Texas, a border town, and the other qualitative study was completed outside of Detroit. These women expressed concerns for their safety, which prevented them from going for walks where they live, concern for availability and cost of fresh food that is considered healthy, and concerns regarding safe transportation and childcare, as many of the women did not drive. These are very simple and obvious concerns that would impact someone's not only prevention but treatment of gestational diabetes. So extracting kind of these main topics and then exactly why these are specific to these Hispanic and Latino women was very eye-opening. So for my appraisal, according to the JBI Levels of Evidence Meaningfulness scale, it assigns levels of evidence to qualitative studies, and JBI addresses that this is one of the most difficult problems in qualitative research, because that of defining clear criteria for selecting high-quality qualitative studies is not the easiest to do. And they developed a specific scale for qualitative studies because although it's not necessarily the quantitative that we're used to, the qualitative studies are important. So the systematic review that I went over, it achieved a score of level 1, and the 2 qualitative reviews were a level 3. The systematic review was a lower level of evidence because it was a mixed method systematic review. The higher level systematic review on this scale is expert opinion, and I did not find any expert opinion systematic reviews regarding the topic of gestational diabetes and the experience of Hispanic and Latino women. So this systematic review did have vague conclusions that were offered by the researchers, and they were clear in stating that more research needs to be done. There was actually only 7 articles that they were able to review, but they did do a very good job at laying out the systematic review textbook style. It was a step-by-step approach, and it was very clear, and they kind of listed out every single part. However, the lack of content ultimately hurt the systematic review, and due to the lack of the expert opinion, it did earn a low level of evidence. Qualitative studies were both single studies and therefore earned a level of evidence of 3. Both studies thoroughly included the exact phrases and quotes stated by the women to encapsulate their true experiences. In one of the studies, the women were compensated for their time and offered transportation and childcare services during their times in the focus groups. The focus of both qualitative studies was the experiences and perceptions of the women they interviewed, and that was carried out throughout the whole study. Both qualitative studies provided implications for further research and the necessity of the topic. Regarding the synthesis of the studies included one systematic review and two which was of qualitative and quantitative articles, and the other two were qualitative studies regarding the experiences of Hispanic and Latino women in GDM. So the systematic review was completed in the US and Mexico. They did state that they had to broaden their kind of region from just the United States to Mexico because they could not find enough studies. They did use the effectiveness and the meaningfulness approach, which made it qualify for my qualitative approach and PICo question. So they investigated GDM intervention programs for the Hispanic and Latino women and how effective they were and what effect they had on these women and how the women felt about them. So it was kind of a good, well-rounded research. However, again, limited studies. There was only 7 that fit their criteria after they broadened it as well. The first qualitative study I did, the experience of GDM among Hispanic women in a U.S. border town. This was a qualitative study. They used an interpretative phenomenological analysis approach. They had 18 participants that were between 25 and 34 weeks pregnant, and they were between the ages of 26 and 40. These interviews were completed with a set of questions that were open-ended, which allowed the participants to take the lead on the responses. And again, these interviews were completed in Spanish, and they were given the option of completing these interviews in English or Spanish. So these women did have choices, and they all chose to complete the interviews in Spanish because it was their first language. The next qualitative study that I kind of delved into was the perspectives of pregnant and postpartum Latino women. This was a qualitative study using focus groups and a longitudinal approach with women from a community health center outside of Detroit. There were 22 participants. They were at least 18 years old, Spanish speaking, and in the 3rd trimester of pregnancy or postpartum. The researchers in this qualitative study, they did find that the women actually enjoyed the study because it got them out of the house and they were able to socialize with other women from their culture who were going through similar things that they may not have been able to talk about or share just being at home all the time. So it really kind of showed how some of these women, especially within their culture, are really kind of, they feel alone, or they don't leave the house often, or they can't drive, or they don't drive. So they are kind of, they kind of hold it all in, but it was nice to see, kind of refreshing in a way of study, that these focus groups kind of brought the real feelings and emotions out of these women. The researchers for this study actually used a coding method to identify reoccurring themes and phrases as stated by the participants. So they were able to create tables and everything according to common phrases and then what the participants actually said and how it was relevant to the study. Now, in regards to implications for practice and research, I do think that this topic of gestational diabetes and the experiences by these Hispanic and Latino women, because Hispanic and Latino women are one of the largest minority groups in the United States. So with that being said, regardless of where you live or where you practice, it's good to know what cultures and what groups make up your areas so you can specifically educate yourself and become more familiar with these cultures in order to be able to help your patients and identify any health barriers or perceived health barriers they may have. So back to the implications for advanced practice nursing. Advanced practice nurses must be able to identify perceived barriers that their patient or patient population has. I learned a lot through this this project because I realized how much the, Hispanic and Latina culture has an impact not only on motherhood, but their approach to motherhood and how they actually take care of their own health. The importance of identifying these barriers to health or health promotion can be the difference between health and illness for this population. And in this case, Hispanic and Latino women, a common topic is the perceived barriers that have been instilled upon them by their culture, feelings, and socioeconomic status. By incorporating cultural competence and community resources into individualized care, outcomes can be changed for these women. And in regards to research, according to Carolyn Ola et al., one of the research studies that I kind of delve into, Hispanics are one of the largest minority populations, representing approximately 17% of the population, and have a higher than average birth rate. So that kind of lets us know, again, how large this culture and population is in the United States, and that if they do have a higher than average birth rate, we should probably look into what is surrounding and affecting the birth rate, what is surrounding and affecting the mothers and the families and whatnot. To capture the needs of Hispanic and Latino women who have or have had GDM in the United States, more qualitative research needs to be completed to capture their experiences from pre-diagnosis throughout their pregnancy. This way we can get a better grasp on what will actually help and what they view as important and how they view their own health. That is one thing with all three of these studies that kind of lacked, was that I wanted to know a little bit more on how they actually viewed their health and what they prioritized for themselves, because it's so heavily impacted on how they are as a mother and as a wife or a spouse in a household, and their roles of cooking and cleaning and taking care of the children in the home. There was clearly a large neglect on their self and their self-health. By identifying the knowledge gaps and culture surrounding motherhood for these Hispanic and Latino women through research, healthcare providers and educators can develop an approach that will work specifically for these women and identify the perceived barriers. So my question for you is, as an advanced practice nurse, what do you think would improve the current practice approaches to gestational diabetes in the Hispanic and Latina female population? And this can be applied to wherever you are or where you will practice as a provider. Thank you for listening, and I look forward to seeing your responses.